like we've got some alcohol here. Oh no, sir. I'm gonna need to take this bottle from you.
No.
Sir, you can't be drinking anymore. His eyes are yellow. We're gonna need a bus. Hello? We need a bus ASAP to 40th and Van Buren.
I think
sir,
he's jaundiced.
Sir, we need you to. We need you to listen. Sir, it sounds like you're in liver failure.
Let go of the bottle. Let go of the bottle.
You can't be drinking anymore. This is a very serious matter.
Okay.
Okay?
I
How
love
many
drink.
drinks have you had today?
12, 15.
Does his liver feel swollen?
Oh, it's huge.
Oh, it hurts.
Oh, it's huge. Oh, it's over here.
It's hurt.
It hurts everywhere?
Yeah.
When was the last time you had a drink other than when we just got here?
2 hours ago.
How many drinks do you have a day?
Many.
If you could give me a number, what would it be?
20.
20 drinks a day? What's your drink of choice?
Everything.
He said 20 drinks today.
Everything.
Of everything.
How many years have you been drinking for?
7 years.
For 7 years.
All right, well, sir, we need to take you to the hospital.
En route.
We might be in liver failure.
Okay.
Okay, let's get out of here.
So how are you doing today after your surgery?
Pretty good.
Good, yeah, you recovered really well. And I'm sure you both have lots of questions for me about cyclosporine. So after your liver transplant, cyclosporine is going to be something you're going to use for the rest of your life. And it's going to help you not reject your new liver. So it's an immune suppressant medication.
Okay.
So you do need to be it on the rest of your life. So with that, there's some things that I want you to look out for. So if you experience any fever, chills, sore throat, fatigue, and some serious infections may occur too while you're on this medication. You could experience also tremor, bleeding gums, and increased blood pressure. So I want you to look out for that. This does not apply to you, but for ladies, usually, you know, if you use contraceptives, it's something you have to wait 12 weeks to start again. So that doesn't apply to you. But, so you want to take this medication at the same time, every day. And you do not want to skip any doses. You don't want to double any doses. And then you do not want to take this with grapefruit, okay? And then if you, and then you do not want to add any other types of medication without first checking in with your physician, okay? This is a pretty, serious medication you're going on it. There are some black box warnings, which would include you want to be limiting your UV exposure, along with, it can cause a few other issues, including malignant hypertension by being on this medication, nephrotoxicity, skin cancer. So you have to definitely, always be in touch with your physician. And other than that, it is a lifelong treatment like we talked about. Do report any severe diarrhea or drug loss. Can happen that way. It can just kind of flush through your body, and we need to make sure you have enough of it in your system. Other than that, you want to do your follow-up labs and notify the prescriber if any of these symptoms are happening, along with any over-the-counter medication, herbs that you may be taking. So do you have any questions for me?
No.
Now, do you feel
It's
pretty
all
good?
clear.
It's all
Yes.
clear?
Mhm.
Great. Well, thank you. It's nice to taking care of you and follow up with your physician.
Thank you so much.
Hey guys. Hi, my name is Rudolph. I used to drink like this too,
Okay.
and then my liver failed.
Good for you.
I
don't drink
almost
that
died
much.
from it. Really?
Yeah, we don't drink that much.
I mean, there's not
I mean,
that much
yeah.
here.
But don't get carried away.
I'm just giving a piece of advice. I almost died from it. I got a new liver, and then the liver almost was rejected by my body. Oh, that sucks.
So now you take meds or what?
Yeah. So there's this med called Cyclosporine. I take it, and my body eventually accepted the liver, and I'm fine and healthy now.
Good
guys
for you.
should-
I got
You-
my vodka. Are you
Okay.
happy now?
Cyclosporine, also named Gengraph, Neoral, Sandimmune, is used for liver, kidney, and heart transplant patients to prevent rejection, or for people with rheumatoid arthritis or psoriasis. Unlabeled uses include recalcitrant ulcerative colitis, aplastic anemia, Crohn's disease, thrombocytopenia purpura, lupus, nephritis, myasthenia gravis, psoriatic arthritis, and atopic dermatitis. Side effects include tremors, head and aches, seizures, encephalopathy, progressive multifocal leukoencephalopathy, confusion, migraine, nausea, vomiting, diarrhea, oral candida, gum hyperplasia, hepatotoxicity, pancreatitis, albuminuria, hematuria, proteinuria, renal failure, hemolytic uremic syndrome, nephrotoxicity, rash, acne, hirsutism, pruritus, hyperkalemia, hypomagnesemia, hyperlipidemia, hyperuricemia, infection, and hypertension. Cyclosporine can increase the toxicity of allopurinol, amiodarone, amphotericin B, androgens, azole antifungals, beta blockers, bromocriptine, calcium channel blockers, carbidiol, cimetidine, colchicine, corticosteroids, fluoroquinolones, foscarnet, imipenem silastidine, macrolides, metoclopramide, oral contraceptives, and SAIDs, melphalan, and SSRIs. Cyclosporine can also increase the effects of L-asparine, digoxin, etoposide, HMG-CoA reductase inhibitors, methotrexate, potassium-sparing diuretics, sirolimus, and tacrolimus. Cyclosporine can increase the action toxicity of digoxin, colchicine, hyperkalemia, potassium-sparing diuretics, potassium supplements, ACE inhibitors, renal dysfunction, aminoglycosides, ciprofloxacin, and SAIDs, fibric acid derivatives, vancomycin, melphalan, ketoconazole. Cyclosporine can decrease the effects of anticonvulsants, napsilin, orlistat, phenobarbital, phenytoin, rifamycins, sulfamethoxazole trimethoprim, terbinafine, ticlopidine, live virus vaccines, immunosuppression, echinacea. Do not take cyclosporine with melatonin, St. John's wort, or grapefruit juice. Contraindications: breastfeeding, hypersensitivity to polyoxyethylated castor oil, INJ only, psoriasis or renal disease, Neoral Gengraph, Gengraph Neoral used with Puba UVB, methotrexate, coal tar, ocular infections, black box warning, uncontrolled malignant hypertension. Precautions: pregnancy, geriatric patients, severe hepatic disease, black box warning, immunosuppression, nephrotoxicity, skin cancer, requires a specialized care setting and experienced clinician.
Slowly going in.
Oh my god.
Uh-oh.
It's going bad.
And I'm fine and healthy now.
Good
You guys
for you.
should-
I got
You-
my vodka. Are you
Okay.
happy now?
I mean, I'm happy if you are. If you're healthy, have a good day.
Bye.
Bye.
Bye. Potato, chili,
Chili?
carrots.